right, so let's celebrate nurses, shall we? And we have Nanachi Amwa, who's a registered nurse and chairperson of the Ghana Registered Nurses and Midwives Association. I got that right. That's Ablekuma District. Today is International Nurses Day. Let's celebrate a nurse today and get to tell me who your favorite is and probably the worst experience you've ever had as well. But I'm sure let's celebrate them and so share the best ones. Good morning and thanks for joining us.
Good morning and thanks for having me.
Do you think that you are underappreciated at any point?
Very much so. I believe so.
You didn't even think about that?
No, I mean, I think it's just because we are many.
Okay.
And because, scarcity adds value.
Okay.
And so if you go to, maybe you go and see a lawyer who they are very scarce. And so you have to pay more to see the lawyer. But because maybe we are everywhere, all over the place, you come, everybody's a nurse in the hospital. The person who gives you your folder, the person who serves your medications, the person who pushes you around. Everybody's a nurse. And so I'm tempted to believe that a lot of people don't value us, for lack of a better word. And also, yes, when the doctor sees you, oh, Dr. Medase. But when the nurse does something for you, I mean, it can go on because that's her job. Or that's his job. Yes,
I see.
Yes.
Interesting. But, I get that feeling too. Probably also, if I have issues with my health, the emotions attached to it once I come to the body, it's okay to value the nurse and appreciate it. And that's why we're doing so today.
Right.
But tell me what's a day like in a nurse's life where you get up in the morning. What do you do before you get to work as a nurse?
Right. So usually, and I'll use the morning shift for this purpose.
Absolutely.
Right. So you get up in the morning. If you don't have a car, you have to think of where you live and how far work is from you. And so if you have to do public transport, you have to get up early, get around the traffic so you can get to work early. Then it starts by taking up from the shift before. If it's the morning, you have to take up from the night nurse. You have to go around to see every single patient, how they are doing, how the night was. Then you take up, and then you leave the night nurse to go on. Then you also do your rounds to see who may need what, get ready for the day's activity, set your tray, your trolley, get ready for ward rounds. When the doctor comes in the morning, they have to go around and attend to every patient. Then you come and plan your day. So this person needs to go for surgery, this person needs to go for blood transfusion, this person needs this and that. So you plan your day, then you can carry them out. So that is how the day really works, goes around for the nurse.
I see.
Yeah,
How many years have you been serving then?
I left school in 2010 plus national service, so about 2012 thereabouts till now, so 10 years.
10 years?
Yes.
You deserve an award though.
I do.
You do, right? I see.
I do.
And why the choice of nursing? And today what I get is that conditions of service are okay, at least better than teachers. And so people want to choose the nursing job rather than the teaching job. Was that for you?
Not at all, not at all. I come from a family of a lot of healthcare professionals, and so when it got to my turn, it was easy for me to make that choice. And so I'm sure it came to me naturally, and my love for people is just an easy way to go around it. So for me, it came naturally. I didn't struggle at all.
I see.
Yeah.
And so clearly you've been doing this for 10 years. Tell me how the journey has been.
Yes, so I remember when I picked the form to go to nursing school, and I trained in Kolebu, the best in Ghana, so yeah.
I see.
Yeah.
Okay.
So,
all right, fine. Yeah. I don't have any knowledge of those ones, and so I'm not going to...
There are a lot more of them, yeah, but Kolebu is still Kolebu.
I hear
the
you.
Premier Nursing Training College. So this was back in 2007, and I remember the pressure in school. I went to school for 3 years, and I always tell my colleagues or my people that I write 6 papers in 4 days for my final exams.
6 papers
in 4 days.
Oh,
it has changed now, but those days it was very, very tough. You need to defend your project work, you need to write your research work, and all of that. So that's the training bit of it. And then from training, you go through national service, you have to rotate through all the major departments of medical practice. And then you wait for your postings. If you want to do the government work, you wait for your postings. Or you want to do a private service. But usually in Ghana, lots of nurses are hooked up to the government work. And so a lot of people wait for government postings. And so you wait for your postings, and then work begins for you, just like that.
I see. How have you been able to deal with the issues that have come up in terms of, I mean, back in the day, well, a lot of our mothers told us that it was love for the job.
Yeah.
Then we moved to a stage where the conditions of service were a bit appreciable, but again, you guys were still asking for more.
Right.
Vis-a-vis the inadequate facilities and the conditions they were under. How were you able to deal with these things?
First of all, we need to understand that that is what we have as a country or a people. And there's one phrase or one word that is common with nurses: improvise. And so you make do with what you have at that spur of the moment. And so if you don't have something we call a sandbag, for instance, a sandbag is something that is a bag that contains sand.
Okay.
So that you can, the patient's foot will not drop because they can't move their legs so much.
Right.
And so what we would do is put water in gloves, tie it, and then put the patient's leg on it.
Okay.
And we do that a lot. So the lack of resources really pushes us to think, innovate, and provide care to the clients, because sometimes the clients do not understand that it's not available. All what they know is they are sick, and you have to care for them. You have a duty to care. And so yours is to provide the care in whichever way it comes, because at that moment, the client needs the care. And so we go all out, we do the best we can to provide the care in the most dire or dire of circumstances. And so it's difficult to work without resources. I must say, times have improved. We ask for some things, and we get them, especially when it comes to working materials. We're getting them now. But for our colleagues who are community health nurses who have to cross 7 great rivers before they get to work, have to use boats and not ships, but canoes, and sometimes it capsizes on them. They go for vaccinations, dogs chase them, they fall in mud. Some have motorcycles, yes, but there's a lot that goes on with the nurse, and we are using this day as a platform to encourage all stakeholders to look at nurses and midwives, to pay attention to them, to give them what they desire. It may not always be salary increment, but for the resources that is needed to provide care to the patient. And don't forget, when you do the triangle, the patient is at the end of all this. The patient suffers when these things are not done. We may come to work and put in our best, but if there are no resources to work with, I beg to say that patients will suffer at the end. And so that is the life of a nurse in Ghana. It's difficult, but we do our best.
Today, the understanding I'm getting is that there are a lot more nurses in terms of, I don't know if it's the overstaffing at the urban centers or peri-urban centers, but as compared to before, where you have only 2 people in a ward, today you have 5, you have 6. Is that okay for a time being? And how do you also juxtapose that with other places, rural areas that are also in need of that?
Right.
Because I'm not too sure a lot of nurses would want to accept postings to go to that place.
Yeah.
Tell me about it.
Yes. So, yes, admittedly, we have seen an increase in the number of nurses who are enrolled. Of course, because of some political things, teacher training allowance, nursing training allowance being restored, those things are factors that feed into increase in demand for nursing or for nurses. And the numbers have increased, like I said. But when we look at the international standards, where one is supposed to cater for four patients at a go, even in Accra, it's 1 to 60, 1 to 32. It's a large number. And I mean, always, the number of patients you have influences or impacts on the kind of care that you can give. If there are fewer nurses, I beg to say the care will be compromised. But if there are more nurses who are ready and available to work, definitely the care will improve. And also, accepting of postings to rural areas has been a problem since, time immemorial. But what we have seen now is that they are trying to put up incentives so that when you go there, instead of waiting for maybe 3 years to go back to school, you wait for only 2 years and you can go to school. So these are some of the incentives the government has put in place to encourage people to accept postings to the rural areas. Of course, like Oliver Twist, we'll continue to ask for more, but definitely let's say the terms and conditions have improved in terms of accepting postings to rural areas. and work being done over there.
Let me allow you to take some water, sip
Right.
some water. No, do so.
I should do that.
Yeah, do that.
Awake, huh?
Yeah, absolutely. The
Right.
issue of how I wish we could open the phone lines, but we have
not?
some few minutes to spend with them so that you could celebrate your nurse. Let me see whether we can make some time for you to call in so you celebrate your favorite nurse. Is that okay? But we're just celebrating them. Today is International Nurses Day. The most important thing we do here is we don't gloss over it at TV Africa. We connect with those who matter most, and we're still spending time with Nanache Amwa, a registered nurse and chairperson of the Ghana Registered Nurses Midwives Association of the Ablekuma district. All right, so the issue also of how nurses react and their attitudes towards patients are largely condemned.
Yeah.
I don't know whether it's widespread but largely condemned by a lot of patients.
Yeah.
Is it a misconception or it's a reality?
That's I beg to say it can be both. It can be both. There are times I've gotten upset at work before, and I mean I am a human being. Yes, I remember an instance where I asked a patient in the heat of the COVID. I remember I asked a patient who had brought in a patient's relative who had brought in a patient that the relative should wear a mask and then get a folder for the patient whilst we attend to the patient. Apparently, he was interested in getting the folder and not hearing my getting the mask, and so he begins to rant and say, "Obi yari, I didn't mask," you know, and then he goes on and on and on. "Me buy you Juma Onuguchi, I can give you mask. What is mask?" When the person is say, "What is?" and I said, "Oh, I just ask you to get a mask whilst we attend to the person. So just get a mask and then get a folder for the person." And then he went on and on and on, insulted and everything, but he came back to apologize. So at that moment, I had to be emotionally intelligent and not to react, but to act. Of course, professionalism would demand of you that you also remain that calm, composed person that you are. And so we get that a lot. Sometimes, you know, the patient is always right in a certain context, and so we don't fault the patient on those lines. But it is true that sometimes nurses and midwives, you know, go the extreme and say things they're not supposed to say or do things they're not supposed to do. But I must say it's better now. It has improved, but we still have some bad apples that we need to amongst us that we need to correct and check. So
have you had as an association, most especially, have you had any, if you like, mechanisms to deal with this, or you think that the council, whatever council that you belong to, is the one that does this? Have you had any? Because we should be able to quickly detect maybe suggestion boxes in the facilities, or someone in charge of these to deal with these things.
Definitely. I mean, these standards are low, and so we don't accept low standards anywhere. The association works in levels, and so there's a national level, the regional level, and the district levels. At the district level, that is where you have the facilities, the various facilities, and so at that level, we encourage nurse managers, we encourage the nurse leaders in those facilities to, as it were, I don't want to use the word punish, but to point it out immediately, call them to order, and deal with them appropriately, because these things cannot continue to go on in 21st century. This is 202 years since Florence Nightingale, and we can't continue to wallow behind in these minor or these mediocre things. And so really, we should be disciplining them at the facility level, and if it is beyond the facility, the Nurse and Midwifery Council will take it up and punish appropriately. And so, yes, we make sure that some of these things are dealt with in its entirety.
I see. Dealt with. Okay. How did you manage? How did you manage the COVID era? I mean, a lot of scare, but of course some motivations as well. Because I knew some nurses who were ready to challenge to hell with COVID. As far as some coins is there to bag there, go out there. Was that how it was?
It was a difficult time, I must say, and especially when it started in March 2020 years, when we didn't know what it was, we didn't know what to expect.
And you were hearing that it was killing people.
Yes, and nurses and midwives were infected. I mean, we were infected but yes, I think we're the largest healthcare professionals that were exposed to the COVID, and we had to put our neck to it and say that this is what we chose to do. and even in a pandemic, we'll stand up and do this. And I believe that we did that to the best of our abilities. Yes, we got infected, but here we are. I think a few also lost their lives in that particular fight, but by and large, we did our best to be able to help the situation and safeguard the situation. And we really, really fought. It was difficult, emotionally draining. Sometimes it was scary. We don't know what to expect. But we put in our best, and maybe we won the fight. I believe we did win that fight. Yes.
Tell me about emoluments, salaries, conditions of service. Is it something a nurse can live on and get a good home, make a good home?
No. I know the perception out there is that nurses are well paid compared to other government workers, but we cannot compare ourselves to any other because we are the most noblest of professions, and so ours is different. For us to be with a patient for hours to see the person get well, other professionals will come and go, but the nurse stays to the patient all the period, all through. The generation before us, most of them, I beg to say, were not able to afford houses before going on pension. So if a nurse has worked for 30 years, she cannot boast of a house of her own. Some couldn't boast of cars of their own. And so it was difficult. It is still difficult. The salaries are not something that I won't say is that bad, but it can be better. Looking at the kind of work we do, it really, really can be better. And so, yes, it's not encouraging, but we stick our necks out there because we love the patients that we are caring for. And like I said, it's not always about salary, but of course the labor deserves its wages. And so we need to be rewarded handsomely as to the kind of work we do. And it brings us to the question of costing nursing services. So the question is, when I bath a patient, how much is it worth? When I administer a drug, how much is it worth? When I dress a wound for a patient, how much is it worth? We are not able to cost nursing services in Ghana, and that's how come maybe salaries are low. If we're able to cost nursing services and say that when I go to work and I dress 10 wounds, every wound is 10 cedis, for example, and so at the end of the day, for only wound dressing, I hit maybe 100 cedis. Then when I feed a patient, is 20 cedis. That makes it maybe 120. So that can aggregate your making hours or the number of the amount of money you receive in a day, translate into a week and maybe a month. That can help us draw a structure for the nurses pay. But we don't have that in this country, and so we just pay what we are paid. So maybe we can look at those things much later on.
I see. Much later. I'm very, very interested in that. The most important thing for me now is that the stock of brain drain.
Yes.
You guys are living. I know of friends who have left. Some of them are still planning to leave.
Yes.
Because of this, you just made mention of the fact that costing, and so you work an hour, you know what you're earning.
Definitely. The opportunities out there are enormous. Thanks to COVID, even before COVID, but thanks to COVID,
it's open.
It's open, and they are living in their numbers. I think my facility, 6 people have left from January to now. Already 6 people have gone, and so it's there, and we have to do something about it as a matter of urgency. Else one day we wake up and we don't have a nurse to take care of our patients. It's alarming now. It's alarming now. And I know there are measures to slow it down.
I'm not too sure.
Well,
I'm not too sure.
You know,
hearing even from the Ghana Medical Association, the General Secretary, I guess?
Right.
No, one of them. Look, you can tell the frustration.
Yes.
We can't get hold and control of the situation.
No.
Because once you gauge what you are earning outside per what you're earning here, I'm not too sure you want to stay.
And migration has always been a problem since, and it's not now. And you can't stop anybody from moving per se. And so something has to be done, and I pray it's done urgently because the movement is serious.
It's serious.
Yes, it is serious.
So that is why when you go out there, you see a nurse, say thank you. After you are sorted out, after you've been taken care of, say thank you before you go, so that at least they could stay. Because one day, They all leave.
Yeah.
Would have to cater for some probably traditional herbalist, and would have to go there. Thank you very much.
You're welcome.
We're celebrating you today.
Right,
God bless
right,
you. Keep
right.
the good work.
Right.
We pray that you stay, even though I can't hold you. That's Nana Chiamwa,
Right,
the registered nurse and a chairperson of the Ghana Registered Nurses and Midwife Association at the Blekuma District. We're celebrating nurses today. I equal to all nurses from TV Africa to all of you.